If we take a look at the averages, on the average of patients with peripheral arterial disease, at least a third of these folks will progress on to critical limb ischemia, which is, of course, the most severe manifestation of peripheral arterial disease. And many of the folks with critical limb ischemia, and those are the ones that I work with primarily, will go on to progress to amputation without any intervention. And a lot of the times, the folks that have CLI, if they do present to an emergency room, the first consult is to an orthopedic surgeon for an amputation. We have to prevent that. Most recently, Dr. David Ali and Dr. Craig Walker have done some work. And about 5 years ago, they took a look at patients that presented for amputation. And of those patients, at least a third of those patients had never had any vascular intervention, and about half of those patients had not even had any vascular studies, such as an ultrasound or anything like that. So I think we need to continuously discuss this with our patients and with our colleagues, and know that peripheral arterial disease and critical limb ischemia is so important out there, and that's why I think it deserves a full day at CIRSE. I am actually talking at CIRSE on the UltraScore study. My talk is related to plaque scoring on the vessel preparation for drug elution day, or the session rather. And the UltraScore registry has interim results for the above the knee cohort, and the below the knee cohort results will be available in 2022. Additional subgroup analysis will be ongoing. So we have a lot of information coming out as far as the plaque scoring plaque scoring part of my talk. And again, more information will come on that. And my talk will actually go into some of the preliminary results, interim results that we have with the UltraScore above the knee study. Other studies that I think are going to be coming to fruition very soon are the below the knee drug-coated stent study with Boston Scientific. The Saval study should have some information soon. The Life BTK study, Abbott is trialing a drug reabsorbable vascular scaffold with a sirolimus drug, and that's using the Esprit stent, which is a new stent specifically made for the periphery, and that is in trial around the world. And then we are doing the microstent trial, which I am the national principal investigator here in the United States, where we're looking at the microstent, which is a woven nitinol stent with a platinum core, which is used to treat the stenoses and occlusions of the tibial vessels, pretty much from the knee all the way down to the ankle. So I think in addition to the drug-coated balloon studies, I think we have some excellent studies coming to fruition soon in the next few years that'll help us in the treatment of critical ischemia and peripheral arterial disease, but specifically critical limb ischemia with treatment of the tibial vessels. Other studies that we are looking at are the deep venous arterialization studies with limb flow, the endovenous bypass studies with PQ bypass, and some other drug studies, but specifically those are good studies. Adequate vessel preparation is the key to endovascular treatments. And I can tell you from the above the knee cohort, the UltraScore registry has resulted in a primary patency of almost 78% at 12 months, and freedom from TLR of about 88% at 12 months. So if you combined the vessel preparation in addition to the other modalities that are going to be talked about, the other atherectomy modalities, as well as some of the other vessel preparation modalities, I think it's incredibly important for the long-term patency of these vessels to have at least some sort of a preparation before we attempt to go in with just a balloon angioplasty. I'm excited to at least have this opportunity on Zoom to continue CIRSE. It's such an important event. Together, we are able to put the minds between Europe and Asia, all over the world with the US, and really share ideas and treatment strategies for these diseases.